Today we are talking things that you can do whilst you are waiting for your joint replacement. Whether it's a hip or a knee replacement, both surgeries are very invasive. They both generally have good outcomes, but because they're invasive, it means there's a lot of tissue healing that needs to occur after your surgery. It's certainly not a quick fix. So a few things that you can do whilst you're waiting. Firstly is exercise. So trying to get that joint in a position where it's got the maximum amount of strength possible and the maximum range possible is going to hopefully get you better a bit quicker afterwards. It's also going to put you in a position where you know the sorts of exercise that you're likely to have to do afterwards. Weight loss is another thing that's really important. If we are overweight, we have more low-level inflammation in our system, and it's this inflammation that is likely to slow down that tissue healing. Lastly, I would just make sure you educate yourself as much as possible about what to expect after the surgery. I speak to many patients that are surprised about how much pain they have, about how much swelling they have, about how long the process of rehabilitation is afterwards. So educate yourself, empower yourself, make sure you know what to expect so that nothing comes as a surprise and you can get better as quickly as possible.